Hi, I'm Karen. I'm an educator with SHQ.
My name is Bronwyn. I'm also an educator at SHQ.
My name is Talanga. I work at Assets, and I also have another colleague, Lucy, who couldn't make it today. So all four of us implemented this project together.
Yes, hers stands for H is for Hura, which is Arabic for strong woman, E is for empowerment, R is for resilience, and S is for sisters. And the young women that participated in the project named the project the Hers Project. And it's a peer education project in sexual and reproductive health for young women from migrant and refugee backgrounds. And we did a literature review of what the research was telling us around young women from these communities, their access to, or barriers to their access to knowledge, and what projects had maybe been already run, and what had worked and what hadn't worked. And but most importantly, we were able to ask the young women themselves. Assets facilitated, Lucy and Taranga were able to facilitate reaching out to young women and asking them to join us. So we did some consultation with the young women and asked them what they felt were important topics. We also did some consultation with staff at Assets, because they work with people in these communities, and to ask their, to draw on their knowledge and their experience, and also clinicians and educators at SHQ. And once we pulled all that together, we designed the project.
We met every Saturday for 6 weeks with the young women. We met them here at Assets, which is a place where they feel safe and comfortable to come. So they already had that trust and comfortability to come here. So we met every Saturday. We'd start the morning off with yoga. The young women in these consultations said that was an activity that they wanted. So it was a yoga cross dance activity, and we found that was really important because it helped to build connection and trust between all the girls, and also between us and the girls. So building connections and that comfortable kind of environment with each other was really important for the whole part of the group and the things we were talking about. And other ways that we did that was sharing a meal every day. So we'd always share lunch, we'd share morning tea, and we also had a lot of activities that built us together as a group, so that everyone had comfortable feelings with each other and felt like that they could participate fully in what we were talking about. So I think building those connections was a really strong strategy that we had in the group, and we really implemented that throughout.
SiREN helped us step through the ethics application, and we were successful, which was really exciting. They also helped us in conducting the consultations with the young women and with designing the evaluation questions.
Yeah. And then they helped us after, when the evaluation questions were developed, about how to pull out those themes. So we held the focus groups following. SiREN helped us to transcribe all that data as well, the voices of the girls, and then helped us to decipher the qualitative or quantitative results from what we'd obtained, and then how to interpret that. The project was a really, really successful one. I think we underestimated the connection that the girls made. They even named it being a sisterhood that they found with one another. So rather than just a standard education session, it was more of a group cohesion that developed. And the girls really increased in their confidence and their ability to talk to one another and to talk to us, and their confidence to actually access services that they have the right to do so. I think they were really big standouts from what came of the group. And unexpected outcomes, when we were running the young women's group, the young men also said that they wanted one as well, which since has been implemented and run really successfully too. And the young women also named up that if we ever did a group like this again, more of a focus on mental and emotional health and wellbeing, which is definitely something that we'll look into next time. But they were some of the really main standout key points. A lot of the outcomes that we evaluated in the pre and post surveys, we found an increase in the young women's confidence, their knowledge, knowledge of their rights, knowledge about their bodies. So a lot of the things that we evaluated had positive outcomes in the end.
Another really positive outcome has been that when we started the program, Lucy, Taranga, Bronwyn and I had hoped that there might be one young woman or maybe 2 young women in the group that when we had finished might be willing to come back if we ran the group again and co-facilitate with us. And that was our hope. We didn't discuss that with the young women because we didn't want to place that expectation upon them. But when we finished the group, we came back all together at the end of the group. 9 young women have said that they want to be co-facilitators with us, and so it's our hope that we will give them some education and some training and some support and build their capacity, and that they will now join us in running the group for other young women.
Yeah.
So there were things that we learned for ourselves as professionals. I believe, like, after we completed this group, even though it was a 6-week project, even after these 6 weeks, we met young women again and again. We had several catch-ups with them, and that whole process helped us to also grow up like as workers. So there were a few things that I would like to highlight. One thing is that the way they respected each other whenever like they had to share very difficult emotional experiences, and it was like we had young women from many different cultures in one group, and some of them have never met before, but they had this like deep respect towards each other, so they actually empathized and understood each other's concerns, and never judge anybody based on the way they dress or based on the country they came from. So that was really beautiful. I think it is something that we would really value. At the same time, we even during the implementation part, we realized we also like saw the impact then and there, because young people, women came and told us how they share this information with their families and friends, and how they talk this information with their mothers especially. And most of the mothers of these young people have never had the opportunity to learn these subjects, or they just like had misinformation. But these young women came and told us how they tried to explain these topics to their mothers, and it was really interesting for us to learn.